to know from this presentation is we do not want anyone stopping their medications. So today we'll be examining our use of medications as a society and as individuals, and we'll be putting a spotlight on the harm that medications can do. It's very important that you take this presentation as what it is, knowledge, and not to stop your medications. So what is all the fuss about medications? Medications have benefits. However, taking too many prescription medications can be risky. So one of the top health concerns for older adults in Canada is medication side effects, as reported in phone surveys. Many healthcare professionals, including physicians, pharmacists, nurses, and others, are also increasingly concerned. So today we'll explore why everyone should be especially careful with their medications and what can be done to minimize the risk and maximize benefits from our medications. So how many medications? What percentage of community-dwelling older adults in Canada take medications? So 65% of Canadians take 5 or more medications. And what about 10 or more medications? It is actually up to 26% of Canadians. And what percentage of people age 85 and older are taking 10 or more medications? And that increases to 39%. So this is really just showing us that as we age, the tendency is to take more medications. Older adults are a diverse group. Until this point in the presentation, we have given statistics about medication use. However, no two individuals are identical. So what works for one person doesn't necessarily apply to another. And there are currently 7.3 million Canadians over age 65. This is a growing population, and there are many types of older people as there are younger people. Older adults are a very diverse group in terms of their health, fitness, and lifestyle. More than half report being in good health, even if 75 to 80% live with one or more chronic condition. And 1/4 of our elderly population lives with frailty. And frailty is a state of health where the person's overall well-being and ability to function independently are reduced, and the person is more vulnerable to health deterioration. The risk of becoming frail increases with age, but the two are not the same. Ethnic and cultural diversity among Canadian seniors leads to a broad range of norms and beliefs around medication use. Each culture has its own way of thinking about health and medicine. So depending on the context, this may result in increased or reduced use of medication. So we will now explore why aging makes us so much more sensitive to the effects of medications. Fortunately for us, life expectancy is longer now than it was 100 years ago. So this is in great part to the advancements in medicine, including medication. However, as we get older, we get more and more chronic diseases, and we also tend to take more and more medications. So taking more medications increases the risk of experiencing harmful side effects. Further, as we get older, medications affect us differently, and the benefits and harms of those medications may change. So what was good for you then may not be so good for you now. So what happens to our body as we get older, and why does it affect how medications are processed? So let's take a closer look here. So our brain becomes more sensitive to drug effects, so this can cause confusion, dizziness, memory issues, or fatigue. Medications may also stay longer in our body because we have less muscle and more fat. And as we get older, our kidney and liver are less efficient at processing these medications and removing them from our bodies. So this means that medications may accumulate in our bodies and cause more side effects. So to wrap up, as we get older, the harms of medications can become more pronounced. Who is at the most risk of experiencing harm from medications? So among the Canadian population, some groups that are at higher risk are people that are over age 65. So as we saw in the previous slide, our bodies change with age and harmful medication effects may become more pronounced. People with multiple chronic conditions, so their bodies may not be able to compensate for the excessive effect of medication, and this can lead to harmful side effects. And women. So women are more susceptible to harmful effects of medications due to their physiology and biology. And the next slide will explain why. So women have a higher risk of harmful effects of medications for several reasons. The female biology and physiology put them at higher risk of experiencing harmful effects of medications. Women tend to suffer from more chronic conditions and are prescribed more medications for these conditions. And they take more medications than men, as women tend to consult their doctors more often than men do. So what is medication overload and why does it matter? Medication overload is when someone is taking a combination of medications that, when used together, can cause more harm than good. So when someone is experiencing medication overload, they're at a higher risk of medication harm. Another term that's often used for medication overload is polypharmacy, which you may have heard before. And what are the risks of medication overload? So scientific research has actually shown that medication overload increases the risk of falls and fractures. So for Canadian seniors, most hospitalizations from injuries are due to falls. So broken bones, if you break your hip, are often due to a fall. Memory problems, so by causing drowsiness, confusion, and a loss of balance. Medications can interfere with attention, memory, language, task planning and execution, or other cognitive functions. And these side effects may be temporary, or unfortunately, they could be long-term. So interactions between your medications. Taking more medications means higher chances of interactions. So medications can have unpredictable side effects when they interact with each other, and these interactions can often lead to harmful effects. They can also cancel each other out, so you really don't get the benefit of either medication. And then hospitalizations. So side effects are common and can have really serious consequences, and studies have shown that 6 to 12%, so about 1 in 10 hospitalizations in older adults, are caused by a side effect of a medication. Over half were deemed avoidable, so a lot of these adverse effects really can go undetected. Medication overload also leads to errors while taking medications, such as forgetting or doubling up on a dose. It's easy to take one medication per day and keep that straight, but when you have between 5 and 10 different medications, you can see how easy it is to get those confused and to make mistakes with them. So prescription medications are but one part of the picture. A vast majority of Canadians take natural health products or over-the-counter medications. And more than 3/4 of Canadians, it's actually 79%, report having at least one complementary or alternative therapy sometimes in their lives. So natural health products include vitamins, supplements, and herbal products. Traditional medicines incorporate plants, animal and mineral-based medicine. It may also include spiritual therapies, manual techniques, and exercises. And then there's over-the-counter medications as well, and these can be bought without a prescription. So these are commonly things like Tylenol, Advil, Gravol. Natural health products, traditional medicines, and over-the-counter medications can cause interactions and side effects. And many patients often forget, for one reason or another, to tell their healthcare professional about these medications. And it is really important to make sure that your healthcare team knows everything that you're taking. So recreational drugs can have adverse effects when taken with certain medications. So alcohol, cannabis, and other recreational drugs can interact with your medications and increase the harms, as serious as death. Taking marijuana with a medication that causes drowsiness can increase that drowsiness, leaving you feeling dizzy and confused. Mixing alcohol with certain medications can cause nausea, headaches, drowsiness, fainting, or a loss of coordination. So this puts you at risk of internal bleeding, heart problems, and breathing difficulties. So it is important to let your healthcare team know if you drink alcohol or use cannabis or any other recreational drugs. So this information really is crucial for them to have to reduce the risk of interactions with your medications, which can be quite serious. And did you know that some medications are considered to be risky? So it's not actually just the number of medications that we take that can be concerning. Some medications have been shown to carry more risk for harm in older adults than others. So a risky medication is a drug whose potential risks outweigh the potential benefits. And there could be a safer alternative that's available. So sleeping pills are risky meds. They affect our brain in different ways. And these medications are considered potentially risky because the potential risks of taking them often outweigh the benefits. So let's explore these risks a little bit here. So some things that can happen when you take sleeping medications are that they can slow your reaction time. They can hinder your ability to plan the steps of a task or how to structure your thoughts. They can cause memory and concentration issues, and they can negatively impact your memory, attention span, and the ability to concentrate. They can impair your coordination, which increases your risk of falls, and they can cause lingering tiredness during the next day. So this really impacts your daily activities. And it's not really uncommon to feel like you're more tired when you wake up when you're taking sleeping pills. So sleeping pills are an example of a risky medication in which the harms outweigh the benefits, especially in older patients. Sedatives are often prescribed as sleep aids, and on average, they help people fall asleep 14 minutes faster. So on the previous slide where you heard all of those risks, it doesn't seem like the benefits of 14 minutes would really be worth it. So by putting your brain to sleep, these medications make you less alert and increase your risk of falls, fractures, motor vehicle accidents, and memory problems. So this would be an example of the risks outweighing the benefits. So there are safer and more effective options to sleeping pills that do exist, and cognitive behavioral therapy for insomnia or sleep therapy is one thing that we do recommend. So sleep therapy is the first-line treatment recommended for patients experiencing sleep issues rather than being prescribed sleeping medications. Sleep therapy doesn't rely on any medications to help restore healthy sleep patterns, and there are lots of resources that are available at mysleepwell.ca. So how many Canadians over 65 take at least one potentially inappropriate medication? So 38% of men and 48% of women. And why are women more likely to be prescribed risky medications? And that's because they're living longer, they tend to consult with their physician more, and therefore they're diagnosed with more chronic conditions and prescribed more medications. And older people, so 85 years and older, are prescribed even more risky medications than this. So what is the cost of this? Prescribing risky medications is extremely costly to our society. The costs include not only paying for these risky medications, but also paying for the healthcare costs and hospitalizations for those who suffer medication effects. And in Canada, they estimate that we spend about $1 billion per year to pay for risky medications for seniors. This figure does not include the associated healthcare costs and treatment for harmful effects from medications, including fainting, falls, fractures, and hospitalizations. So that's a pretty staggering number, considering that this is what we're paying for medications that are not the best options. So medications also have environmental impacts. Manufacturing of medications accounts for a significant proportion of the healthcare system's greenhouse gas emissions, and the healthcare sector is responsible for approximately 5% of the global emissions in Canada. So medications account for about 25% of the Canadian system's emissions, followed closely by hospitals. So actually, it's medications that have a bigger impact than every hospital in Canada. So water and soil contamination can occur, and there is also an impact on biodiversity. So when animals are exposed to certain active ingredients in medications, it can negatively impact them. So there are certain species of fish in Ontario that after they were exposed to contraceptive medications, they were actually almost driven to extinction due to the feminization of male fish, which, are things that we don't often think of when we're disposing of medications. So this is a bit of a case series, and it's a medication overload story, and we're going to meet Fiona. So Fiona is a 69-year-old woman. So she has been feeling lightheaded lately, especially when getting up from her bed in the morning, and she says she feels like she is energyless. She had 2 near-miss falls over the past month, but luckily she caught herself on the furniture. She feels a bit anxious about the idea of going out for coffee with friends. She is isolating herself, and she takes medications for her diabetes and her high blood pressure. So how can patients, caregivers, and healthcare professionals work together to prevent harm from medication? So what can we do to change things? How can we help people like Fiona? And this is sort of the practical portion of the presentation. So let's reduce medication harm with deprescribing. And deprescribing is part of the solution to the problem of medication overload and risky medication use. We can deprescribe medications that may cause more harm than good, so when the risks outweigh the benefit. Deprescribing means reducing or stopping medications that may not be beneficial and may be causing harm. And the goal is to maintain or improve the quality of life. So whenever you are prescribed a medication, there should also be a plan or monitoring system in place to determine when the medication should be reevaluated to see if it can be reduced or stopped. And it's very important that deprescribing is always done as a team with your doctor, nurse, or pharmacist. It's extremely important that you don't stop your medications yourself without speaking to a healthcare professional. So the goal of this graph is to show that medication review should be integrated within the normal prescribing process. So here we have a graphic showing when deprescribing can occur in the prescribing process. So one might think that after being prescribed a medication, all that's left to do is take it. However, that's really only the first step. If no end date for the prescription is provided, it's important to have the medication reassessed on a regular basis by a healthcare provider. And the goal of this reassessment or review is to make sure that the medication is still in alignment with the patient's goals and that the medication is working, to determine if the patient is experiencing any side effects or if they are benefiting from it. So during the reassessment, the patient, caregiver, and healthcare provider will assess whether the medication should be continued or if the medication should be stopped. And really that's called deprescribing. So this is a continuous process, and as you can see within the cycle. So even when a decision is made to continue a medication, another reassessment should always be planned again in the future. So accessing deprescribing, ask for a review of your medications. So as we described in the previous slide, a medication review is really a necessary step to take with your healthcare provider and to ensure that all of your medications are still safe and appropriate. A medication review helps identify any issues with medications and is an opportunity to assess whether medications can be reduced or deprescribed. So let's return to Fiona's story. She needs a thorough review of her medications to look at opportunities for deprescribing. So how can she get a medication review? What are the steps that she has to go through to get one of these completed? So first, you should book a special appointment with your doctor, pharmacist, or nurse to review your medications. And this is really the preferred approach, as a thorough medication review can take quite a long time to complete, depending on the number of medications, natural health products you're taking. So asking during this appointment where healthcare providers may be busy or they don't have that time set aside, often doesn't result in a comprehensive medication review. So preparing for your med review, obtain your list of medications. So your pharmacist or pharmacy staff can also print a list of all prescribed medications, have the dose and instructions included, when you started taking that medication and when you should have stopped it, if there is a stop date. And this list is useful for the healthcare provider helping to review your medication. It's also really important from your perspective to not forget to add any of the supplements, vitamins, or natural products you take to your medication list. So reflect on your health and goals. It's important to prepare one's questions and be ready to answer the healthcare provider's questions. How are your medications affecting you? Are you experiencing any problems with them? So it's important to identify any challenges or concerns or frustrations that you're having with these medications, and then really sort of decide what are your goals and your values. This means reflecting on your quality of life that you want to achieve and if your doctor recommends stopping one or more of my medications, will you be willing to do that? It's also important for you to prepare a list of questions for your appointment. So here are some suggested questions that we often ask patients. Why are you taking a medication? And knowing the reason you're taking a medication will help you and your healthcare providers determine if the medication is helping or not. What are the potential benefits and harms of the medications? Can it affect my memory or cause me to fall? Can I stop or reduce the dose of this medication? And who do I follow up with and when? So if you and your healthcare professional decide to reduce the dose or stop a medication, you may need to be followed more closely. And the reason for that is that you can actually get adverse drug withdrawal events. So if nothing was changed, your medication will still need to be reevaluated in the future, and it is best to know when. And step 5 is to work as a team with your healthcare provider during the medication review. It's important to keep in mind that the decision-making process is a shared one, and this means it's a two-way conversation. So you know your body, you know your symptoms, and you know your goals, and you should also ensure that you are informed about your medications and why you are taking them. The healthcare provider knows about medicine, medications, the physician is an expert in medicine, and pharmacists are expert in medications. So the patient or a caregiver and healthcare provider need to work together to determine the best treatment. So it's really important to be proactive in your healthcare journey and as much as possible to make informed decisions. The more you inform yourself and ask questions, the more informed your decision will be. And research has actually taught us that patients do better when they participate in their own care, and healthcare providers are more likely to consider deprescribing if the patient or caregiver brings it up. So let's talk about worries and challenges because they are real. Many people report fears or challenges preventing them from asking their healthcare provider questions about their medications. And this is normal, especially since we are told that reevaluating or stopping medications is a normal and important part of the process. So some worries and challenges. What if my healthcare provider doesn't have the time? So we know that physicians' offices and pharmacies can be busy. Reviewing your medication is part of the prescribing journey, and asking questions about medications is part of your care. So time should be made to answer these questions, and booking a specific or special appointment with your doctor or pharmacist will ensure that you have the appropriate time to get this done. So what if my family doctor is reluctant to change my specialist's prescription? Research has shown that doctors can be reluctant to change or stop other doctors' prescriptions. So by asking your family doctor about a medication prescribed by a specialist, you open up the conversation on deprescribing and invite them to question what you were prescribed. A family doctor is allowed to review and change your specialist prescriptions, although they may want to engage in a conversation with your specialist about this. Can I ask about a medication that has shown no adverse effects? And yeah, absolutely. You can and should always ask about medications that don't appear to be showing any negative effects. Side effects and adverse reactions can happen at any time while taking medication, so not just while you're starting it. And it's really important to discuss on a regular basis whether each of these medications is still needed. And again, we go back to that point of, balancing the potential risks versus benefits. Because if you start a medication 10 years ago, it could be very beneficial. But, your bodies can change a lot over 10 years. And, 10 years later, that medication might be providing you more risks than benefits. So what if my symptoms return when I stop medications? So return of symptoms is possible. And in some cases, the return of symptoms could only be temporary or a withdrawal effect like we talked about. So working with healthcare professionals to help you distinguish the return of symptoms from temporary withdrawal symptoms and what to do if this occurs. And that's often very difficult if you're stopping a medication and your symptoms come back, to determine, are my symptoms back for the long haul, or is this just something that's going to take a week or two to subside? So a medication review and deprescribing. This helped Fiona. So let's go back to Fiona's story. She asked her doctor for an appointment to review all of her medications. And during the appointment, Fiona's doctor reviewed her medications and saw that one of her new diabetes medications had contributed to lowering her blood pressure. So after some discussion, one of her medications was stopped and another one was reduced. 2 weeks later, she's feeling like her old self and resumed her activities. So deprescribing, with the help of a medication review, really helped Fiona in this circumstance. So be on the lookout for medication overload. Regularly reviewing all of your medications with healthcare professionals is essential for preventing medication overload and protecting your health. So other signs you may want to consider recommending a medication review for someone you care about, or a medication review for yourself include if you've noticed memory issues or forgetfulness, if you've experienced any falls or feel less stable on your feet, if you've observed changes in your ability to think clearly, such as trouble finding the right words, and if you're feeling overwhelmed by the number of medications you're taking. So in these cases, I think it's worth asking yourself, when was the last time I had my medications reviewed? And then, a medication review can help identify whether your current treatments are still right for you or whether changes might actually improve your quality of life. So a medication review could help in all of these situations, really. And here we also flag the following side effects. So Mary feels like her memory is playing tricks on her. She has a hard time remembering. This bruise on my arm, I almost fell last week, but I'm sure it's nothing. And I'm not coming to group activity this week. Don't tell anyone, but I'm having trouble holding my urine lately. A medication review could also help if you're annoyed by having to take all of these medications. And, something to consider is taking a medication 4 times a day, right? So if you need to take medications at breakfast, lunch, supper, and bedtime, that's really your full day. Are you going to take your medications with you if you go out for lunch or if you're out for the afternoon, or are you trying to race back home to get those in? Or do you skip the doses? So what else can you do? As much as possible, I think the most important thing you can do is inform yourself about your medications and why you're taking them. So patients who are informed about their health and the treatments are then able to make better decisions that better support their health. So engaging in discussions with your doctor, pharmacist, or nurse about deprescribing. Healthcare is meant to be collaborative, and no one knows your body better than you. So spreading the word about deprescribing, talking to your friends and your neighbors, your government representatives, and even your health providers may need to be informed. So ask questions, stay informed, be proactive, and participate in making informed choices. So these are actually some free medication safety and deprescribing resources that are available. This is the Deprescribing Network, and they have lots of great pamphlets that are available to talk about what you need to know about deprescribing, if I still need to take this medication, and some general safety information to know about medications when we get older. They have lots of great articles that are available on their website. So are you a victim of a prescribing cascade? And for those of you who don't know what a prescribing cascade is that is when you treat a side effect of a medication with a new medication. So instead of recognizing, I may be experiencing an adverse effect of this, there's some few things that I can do. We give you another medication. And the problem with that is that new medication may cause issues which could potentially be treated with yet another medication. So it's really easy to get caught up in a prescribing cascade and end up on multiple different medications. The Talking About Medications workshop series, this was designed by the public in partnership with deprescribing.org, and all of these materials are posted freely online, and you can find the participant workbook probably the most helpful, and this can all be found at the deprescribing.org. And I think that's it, actually. Let me see if there's any other questions. I think there's a few slides at the end, yeah. But I think this is a great spot to stop and see if there are any questions that people have.
Yeah, there are actually a few questions in the chat. I'll just go ahead and read them to you.
Sure.
So our first question comes from Mary Alice, and they're wondering if melatonin is considered risky.
That's an interesting one. It's definitely not as risky as prescribed sleep medications. Um, for short-term use and for specific indications, so for REM sleep behavior disorder, for instance, the benefits would outweigh the risks. I think it's also important to determine how it makes you feel. So if you wake up every morning and you still kind of have that hangover effect, if you're still feeling groggy, if you feel like your balance is affected, um, then the risks may start to outweigh the benefits. But generally speaking, melatonin is pretty benign compared to other sleeping pills.
Okay, great. Thank you. Our next question comes from Brenda, who is wondering how often you should get a medication review.
So I believe that the government, and I'm not as proficient in this area as I used to be because I don't work in community pharmacy anymore. But the pharmacare program will actually pay for, I believe, 1 to 2 medication reviews per year at community pharmacies. And then you can also ask, your prescriber to do those with you throughout the year as well. I think, a reasonable expectation would be to have, at least 1 or 2 per year. Or if you are started on a new medication and begin to have issues.
Okay, great. Thank you. Our next question is also from Brenda, who's wondering, is there an ideal amount of different medications that you should be taking as you advance in age?
Unfortunately, no, because it really does depend on someone's chronic conditions. So, if someone has heart failure, there are a certain subset of medications that we use to help increase mortality and prevent them from going into the hospital. If you've never had any heart disease or you really don't have any chronic conditions, um, then those people would not need to take that the same amount. So it really does depend on the individual.
Okay. Next question is from Therese, and Therese says, caregivers often have a dual role for themselves and for their care recipient. Can you also speak to long-term care and med reviews?
So long-term care, the patient is gone to a long-term care facility. Um,
Yes, that's what I was referring to.
okay.
Like what are their what is the avenue of somebody in long-term care to have those same med reviews?
Yeah. So I know in Cape Breton, it's the Lawton's long-term care facility that looks after all of the long-term care homes around here. And they used to do a full med review yearly. I don't know if that still happens or not, but I think it's worthwhile asking, the head nurse or the patient navigators that are in these homes to request it because anyone can request a med review happen.
Thank
Okay, thank you. And Pat was wondering what the other term used for medication overload was.
Polypharmacy. And polypharmacy is actually probably the more popular term. It's only in the last few years we've sort of changed um, that into medication overload. But I think the important part about polypharmacy is knowing that there's really 2 different types. So there's appropriate polypharmacy and then inappropriate polypharmacy. Because say we take that heart failure patient again, they're going to require being on multiple medications, and that's okay for that disease. They may require 5, 6, 7 medications to manage that, and that's appropriate. However, if I start taking 2 sleeping pills prescribed and then start taking Gravol and Benadryl over the counter to help me sleep, that would be considered inappropriate polypharmacy.
Okay, that's great. Thank you very much. I'm not seeing any more questions in the chat. So we will move on to if anybody has any questions and they wanted to ask them over the mic. Just remember that this is, a public space, so try not to include any personal medical details when you're asking your questions.
I was just going to make more of a comment. It's just I come across a lot of folks, and even within my own family situation, where they have a lot of difficulty questioning what a practitioner has delegated as the treatment plan. So
Mhm.
I think that's a whole other issue to get comfortable with in terms of, you know, if I look at my parents, they just would never question a doctor.
Yeah.
Like that was
Yeah.
just the way it is. So it is hard for people to change that mindset to know that you can question.
It is hard. It's really hard. And, at one point in time, a lot of these medications were really beneficial, right? Um, because, our brains weren't as vulnerable and our kidneys were functioning better and, we had more muscle. So things were just moving through our body easier. And it's hard to say, especially as physicians retire, and, you get a new physician, you come with all of these medications, I've been on this for 20 years. It's worked great, right? It is hard to have those conversations.
Well, and I think with doctors, coming and going right now in the
Hmm.
province, I think there's an assumption that just because somebody else has come on and they've renewed the prescription, that's
Yeah.
the review. Like,
Yep.
well, the doctor didn't say anything or
Yeah.
didn't question it. The pharmacist didn't question it. So,
Hmm.
people kind of assume that somebody else is looking out for their well-being, I guess.
Yeah. It is. And, um, it's hard to take responsibility of your health if cognitively you're not where you were 5 or 10 years ago, right? That's very challenging. And it's also challenging for family members and care providers because there's so much on your plate already, in the run of a day to now think, oh gosh, now I have to think about all these medication changes.
Thank you.
Okay, thank you. If nobody else has questions, I guess we can wrap it up there. So thank you so much, Ellen, for a wonderful, informative presentation. We will, if you're able to, can you send me the resources that you included at the end so we can send them out when we send out the presentation?
Sure.
All right, wonderful. Well, I suppose that's a wrap on everything. Thank you so much, everyone, for joining us, and I hope we all have a great day.